Have you ever walked into a room and completely forgotten why you were there? Or started reading a paragraph and had to go back 3 times, because your mind just drifted off? Do you ever feel like your focus is slipping away more often now, but everyone just tells you it's normal for your age? Well, what if I told you, it's not always about age? As a brain doctor, I hear this all the time: my memory is not what it used to be, I can't concentrate, I feel like I'm always in a fog. And the worst part? Most people brush it off. Until it starts to affect their confidence, their safety, and their relationships. Today, we're not brushing it off. Because behind that fog could be a real medical cause. And if we catch it early, yes, even at 60, 70, or 80, we can slow it down. So stay with me, we're diving into what's going on with your brain. When concentration slips, and how to tell the difference between just getting older and something more serious like dementia, vascular issues, or even early Alzheimer's disease. Let's get clear about what your brain is trying to tell you, before it starts screaming. Let's be honest, most people over 60 notice it. That weird blank space where a word used to be. That moment you're mid-sentence. And suddenly, nothing. Or you're sitting with friends, trying to follow the conversation, but it feels like your brain's running 2 steps behind. That's not just forgetfulness. It's not just getting older. It's what I call silent brain fog, and it's often the first sign your brain is working harder than it should. You see, when we're young, our neurons fire fast. But as we age, inflammation, poor circulation, and even undiagnosed conditions like vascular dementia or early Alzheimer's disease can slow everything down, without warning. You might not notice a huge change at first. Just a little confusion here, a little tiredness there. But over time, it starts chipping away at your concentration, your memory, your confidence. And slowly, quietly, you pull back from life. That's why I tell my patients, don't wait until things get bad. Dementia symptoms don't always start with memory loss. Sometimes they start with these tiny lapses in focus, these moments that feel like nothing, but are everything. So if any of this feels familiar, please don't ignore it. Because what comes next can be prevented if we act early. Now let's get into the real stuff, the things no one tells you when your brain starts acting off. Because sometimes it's not you. It's your body sending quiet SOS signals. Let's break down a few of the big ones. First, vascular dementia. Most folks think dementia means you forget names or places. But with vascular dementia, it often starts with slow, fuzzy thinking. Why? Because your brain's not getting enough blood. Tiny vessels get damaged, and it's like trying to run a computer on a 10% battery. It still turns on, but nothing runs right. Second, uncontrolled blood pressure. When your blood pressure's up and down, your brain can't stay balanced. That messes with attention, sleep, and even mood. And long term? It raises your stroke and dementia risk sky high. Then there's diabetes. Yep. Sugar messes with memory. High blood sugar causes inflammation that shrinks parts of your brain. Especially the hippocampus, the memory center. It's like pouring syrup into your keyboard. And don't forget depression. Older adults often hide it. They say, I'm just tired, or I don't feel like talking. But the truth is, dementia and depression often go hand in hand. And both can cause serious cognitive decline. So if your focus is off, don't just ask, am I getting old? Ask, what's my body trying to tell me? Because your brain isn't just aging. It might be struggling. And the sooner we know why, the faster we can bring it back. So you've been zoning out lately. Losing your train of thought. Walking into a room and asking, wait. What was I looking for again? That's not just annoying. That's your brain asking for a checkup. And thankfully, we've got ways to listen. First up, a basic memory test. Nothing scary. We'll ask you to remember a list of words, maybe repeat a story, or follow a few simple steps. It helps flag early signs of dementia symptoms, especially the ones folks miss, like trouble planning or losing focus mid-task. Next, a blood test. We're not just checking sugar or cholesterol. We're looking for vitamin B12 levels, thyroid function, and signs of inflammation, all things that can mess with senior brain health without causing any obvious pain. Then, a brain scan. Now, don't panic. It's not always necessary. But when it is, it helps us spot vascular dementia, early signs of Alzheimer's disease, or even tiny strokes you never knew you had. And here's the deal, early diagnosis of dementia isn't about fear. It's about giving your brain a fighting chance. Because the earlier we know, the more we can do. And sometimes, just one test can flip the script, from I guess I'm slowing down to let's fix what's broken. A few months ago, I met someone who reminded me why early checks matter so much. His name was George, 68 years old, retired high school coach in Minnesota. Tall guy. Still fit. But something had changed. He told me, "Doc, I feel like I'm reading the same page over and over again. But the words don't stick." He laughed it off at first. Said maybe it's just getting older. But I saw the worry in his eyes. The kind that lingers after you forget where you parked, not once, but 3 times in 1 week. So, we ran a few tests. Blood work. Memory check. And a brain scan. What we found wasn't dramatic. No major damage. But just enough change in blood flow to suggest early vascular dementia. And here's what changed everything, it wasn't too late. We worked on a simple routine, daily walks, adding more omega-3s to his meals, adjusting his blood pressure meds, and even adding a memory journal. Within 6 weeks, George came back and said, "You know what, Doc? I'm remembering names again. Not all of them, but I feel sharper." That's not magic. That's dementia prevention. When it starts on time. And George? He became the guy who tells all his friends, "Get checked. Don't guess. Your brain deserves better." Now here's something most people don't expect, sometimes, your brain fog isn't about aging at all. It's about the meds sitting right there in your cabinet. Blood pressure pills. Sleep aids. Even allergy meds. They may be helping one part of your body, but quietly turning the lights off in your brain. Take Mr. Howe, for example. He's 72, sharp as a tack, or at least he used to be. Until his doctor switched his meds. 3 weeks later, he couldn't remember where he had parked. Or what his daughter just told him 5 minutes ago. That wasn't dementia. That was his medication, causing memory loss. And the sad thing? It happens all the time, but no one talks about it. Especially in older adults, where drug sensitivity is higher. Some medications can trigger cognitive decline, or mimic early dementia symptoms, things like forgetfulness, slow thinking, land of focus. I'm not saying to stop your medication. Never do that without talking to your doctor. But I am saying, if your concentration drops suddenly after starting something new, it's worth asking, could this be a side effect? Let me ask you something. When was the last time you had your vitamin B12 or folate levels checked? Or magnesium? These might sound like small things, but for your brain, they're big players. B12 helps make healthy blood and protects your nerves. Without enough of it, the brain slows down. You feel tired, unfocused, maybe even a little depressed. And guess what? Low B12 is super common in seniors. Because as we age, the stomach stops absorbing it properly. It's one of those hidden dementia risk factors we don't catch early enough. The same goes for low folate or magnesium. These are nutrients your brain uses to stay alert and stable. If they're missing, it's like running a marathon on half a tank of gas. So if your memory feels fuzzy, if your thinking feels cloudy, don't just assume it's aging. Ask your doctor to run blood work. Look at the simple things first before worrying about dementia or cognitive decline. Because sometimes, brain health is about what's missing, and not what's broken. Now here's something that surprises a lot of people. Did you know that depression can act like dementia? Yep. It's called pseudodementia, where someone feels slow, forgetful, confused. But the real root cause isn't brain damage. It's untreated depression. And this happens more than you think. Especially in seniors living alone or grieving a loss, or even just going through big life transitions after retirement. You see, dementia and depression often walk hand in hand. They mess with the same brain areas, affecting memory, focus, even how we speak or make decisions. That's why it's so important to talk about how you're feeling. Because poor concentration might not be about the brain failing but about the heart being too heavy. And here's the good news. When we treat the mood, the brain often follows. Clarity comes back. The fog lifts. So don't ignore the emotional side. Dementia prevention also means caring for the soul, not just the circuits. So if you've been feeling a little off, forgetting names, zoning out mid-conversation, or struggling to follow a story on TV, please hear this: you're not lazy. You're not broken. And you're not alone. There are real medical reasons behind poor concentration after 60. From vascular dementia to vitamin deficiencies, from dementia symptoms to sleep apnea, from emotional overwhelm to hormonal shifts. And the best part? Many of them are reversible. Manageable. Sometimes, even preventable, with the right support and a little curiosity. So the next time your mind goes blank, don't just shrug it off. Get curious. Ask questions. Because early diagnosis of dementia can change the whole story. Your brain deserves that chance. You deserve that chance. This isn't about chasing youth. It's about protecting your clarity, your independence, your beautiful, complex self. And hey, if this resonated with you, share it with someone you love. Because maybe they've been quietly struggling too. Let's start a new conversation about senior brain health. One that's hopeful, informed, and filled with heart.